Obesity is a complex disorder involving an excessive amount of body fat that is not just a cosmetic concern. It increases the risk of diseases and health problems in individuals such as heart disease, diabetes, and hypertension. Obesity and its risk can further be complicated for females who become pregnant. As the prevalence of obesity is increasing, so is the number of women of reproductive age who are overweight and obese. The World Health Organization defines obesity as a BMI of 30 or greater. It is further characterized into BMI Class 1 with a BMI of 30 to 34.9, Class 2 with a BMI of 35 to 39.9, and Class 3, which is a BMI greater than 40. Maternal obesity increases the risk of a number of pregnancy complications for the expectant mother. Preeclampsia remains a leading cause of maternal and perinatal morbidity and mortality worldwide. Preeclampsia is diagnosed by new onset of hypertension and proteinuria that occur after 20 weeks gestation. Obesity increases the overall risk of preeclampsia by approximately 2 to 3-fold. The risk of preeclampsia progressively increases with increasing BMI, even within the normal range. Gestational diabetes is a type of diabetes that develops only during pregnancy and is usually diagnosed in late pregnancy. Gestational diabetes happens because the mother's body cannot make enough insulin. During pregnancy, a woman's body makes more hormones and goes through many changes that causes the body's cells to use insulin less effectively, which is known as insulin resistance. High maternal BMIs have been consistently associated with an increased risk of gestational diabetes. Obesity during pregnancy is related to higher overall healthcare expenditures measured by length of stay after delivery and use of other services. The majority of this difference is caused by higher cesarean section rates and higher rates of high-risk obstetric conditions such as diabetes and hypertension. C-section is more difficult to perform in obese patients. Apart from the immediate operative risk, the increased C-section rate in overweight and obese women is also associated with an increase in postoperative complications such as wound infection and breakdown, excessive blood loss, DVT, and postpartum endometritis. Neural tube defects are among the most common, most costly, and most deadly of all human congenital anomalies. Pre-pregnancy obesity is a well-established risk factor for neural tube defects. In 2013, a study in Texas found that risks for certain birth defects, such as ventricular and atrial septal defects, pulmonary valve atresia, and clubfoot, increase with increasing BMI. Risk for spina bifida, tetralogy of Fallot, and cleft lip substantially increased with BMI greater than or equal to 30. Fetal macrosomia, or a birth weight greater than 8 pounds and 13 ounces, has implications for maternal and neonatal morbidity, including increased risk of instrumental childbirth, emergency C-section, and birth injury. Fetuses of obese gravidas are at increased risk of macrosomia. The delivery of a macrosomic infant has potentially serious consequences for the infant and the mother. The most feared result of macrosomia is shoulder dystocia, and up to 1/4 of infants with shoulder dystocia experience brachial plexus or facial nerve injuries, or fractures of the humerus or clavicle. Stillbirth is defined as the intrauterine death and subsequent delivery of a developing infant that occurs beyond 20 completed weeks of gestation. The reported risk of stillbirth is 2 to 5 times higher in obese compared with normal weight women, and data from multiple sources show that obese women are at a higher risk of stillbirth the higher their BMI and the later the gestational age. Prevention of complications related to obesity in pregnancy is best achieved by prevention of obesity. Get healthy before you get pregnant.